Hello friends, Cricket World Cup is going on and the cricket fever is at its peak. Uh, Cricket lovers are glued to their television sets. Now, this is for the cricket lovers. You might have observed that whenever there is a left-handed batsman batting, opposing captain generally brings on the off-spinner. It is said that for the left-handed batsman, off-spinner or off-spinning deliveries are a little difficult to play. What is the reason behind it? What's the physiological reason behind it? Yes, there is a physiological reason and I'm going to discuss that physiological reason in this video. Now, first of all, let's talk about the cricket aspect of it. Whenever a left-handed batsman is batting and the off-spinner bowls, the trajectory of the ball is such that momentarily the ball goes through the blind spot of the left-handed batsman, and this becomes a handicap for that left-handed batsman, and this is the reason why the opposing captains, they always bring on the off-spinners when the left-handed batsman is playing. Well, mind you, this is not the case with right-handed batsman facing a leg spinner. It does not happen. The trajectory of the ball is different. But certainly in the case of left-handed batsman, a lefty facing an off-spinner, the ball, when it is delivered, momentarily goes through the blind spot of the left-handed batsman, and because of this the batsman might feel little crippled while facing the ball, and this is the reason that they find it difficult to play the off-spinner. Now that brings us to the physiology of it. What is blind spot? What is the concept of blind spot? So let's understand the physiology in detail now. First thing, this is the lateral view, cross-sectional view of the eyeball. Now if you see here that light rays entering the eye, they fall on various parts of the retina. Most of the retina is sensitive to the light rays, and therefore we are able to see all those objects from which the light rays enter the eye. But on the retina there is a small area which is called as optic disc, shown here. Now this optic disc is an area on the retina from where the optic nerve leaves the retina. And the important point is, in this area there are no photoreceptors. There are no receptors for vision. Alright, and therefore the light rays coming from a particular object in our field of vision, if they are falling on this particular part of the retina called as optic disc, then that object won't be visible. Obviously, because the light rays coming from such an object, if they are falling on the optic disc, there are no photoreceptors in the optic disc, and therefore that object, that particular object is, it can't be seen, it won't be visible. So what is blind spot then? Very often I ask this question to the students in Viva, and they simply say blind spot is the spot on the retina from where optic nerve or second cranial nerve leaves the retina. No, that's not the correct answer. Blind spot, let's define it. Blind spot is a small area in the field of vision from where the light rays come, enter the eye and fall on the optic disc, and therefore we are blind to that particular area in the field of vision. If the gauge is fixed, there will be a particular angle in our field of vision from where the light rays will come, enter the eye and fall over the optic disc, the optic nerve head. So that spot, that area will not be visible to our eye. That's the blind spot concept. So blind spot is not the spot on the retina, it's the spot in the field of vision. Now having said this, let's understand where exactly is the blind spot located in our field of vision. If you see this diagram, the two eyes and the field of vision is divided into 4 quadrants. Towards the nose is the nasal field of vision, and on the outer side there is temporal field of vision. So nasal, temporal, upper and lower. Similarly for the other eye also, you can see nasal on the side of the nose, then temporal on the outer side, and then upper and lower. Now, blind spot in the field of vision is on the temporal side in the field of vision. So let's say this is the eye, right eye, then temporal field of vision, about 15 to 17 degrees on the temporal side, so here, and about 1.5 to 2 degrees below the horizontal line. So temporal field of vision, 15 to 17 degrees. If this is the 0 degree, if this is the axis of 0 degree, then 15 to 17 degrees somewhere here, and 1.5 to 2 degrees below the horizontal line. So this would be the blind spot in the field of vision for this particular person, or the right eye of this particular individual. And therefore you can see now that if the trajectory of the ball is such, suppose this is a left-handed batsman facing, and the ball off spinner bowling, and it goes through the blind spot because it is in the temporal field of vision, that the ball is coming through the temporal field of vision and momentarily goes through the blind spot. Look, the field of vision ahead of the blind spot and behind the blind spot, it is seen properly. Only that particular area is not visible to that particular eye. So that's the location of the blind spot. In the temporal field of vision, you can see here, right eye, temporal field, 15 to 17 degrees. So if this is a 0 degree axis, then 15 to 17 degrees somewhere here, and 1.5 to 2 degrees lower below the horizontal line. This is the horizontal line, so below this. This will be the angle. If the light rays for the right eye, in this case, in this particular diagram, light rays coming from this particular angle, 15 to 17 degrees in the temporal field, like this, and they enter the eye, they are going to fall on the optic nerve head, and therefore such light rays will not be visible to that particular eye. So that is the definition of the blind spot. One or two more questions should be answered. Why don't we appreciate a blind spot normally? We don't know where the blind spot is. We can see all the things clearly. Yes, we can't appreciate the blind spot because of our binocular vision. This is a question commonly asked in the Viva. Why can't we appreciate the blind spot? The reason is the binocular vision. Look, if the light rays are coming from a particular angle, for the right eye, for example, the light rays are coming from a particular angle and they are falling on the optic nerve head for, let's say, right eye. But these light rays will also go to the left eye, and they will enter the left eye and fall on the sensitive part of the retina, not on the optic nerve head of the opposite eye. And therefore, blind spot of one eye is covered by the sensitive part of the retina of the other opposite eye. And therefore, normally we are not able to appreciate a blind spot in our field of vision. So, I thought just I'll use the cricket analogy to explain the concept of blind spot. Remember, where is the location of the blind spot? In the temporal field of vision, 15 to 17 degrees in the temporal field and 1.5 to 2 degrees below the horizontal line. So for the right eye, somewhere here, this will be the angle. Light rays coming from this angle will enter the eye and fall on the optic nerve head, and therefore such an object placed exactly at that point will not be visible to that one particular eye. But why can't we appreciate the blind spot normally? because of the binocular vision. Because even though light rays are coming from one particular angle and falling on the optic nerve head of one eye, but those light rays will also enter the opposite eye and will fall on the sensitive part of the retina. So that other eye has compensated or covered the blind spot of one eye. So that was a small little concept related to the blind spot. Much more to come in the subsequent videos.